Morning class. Am I audible?
Yes, sir.
Okay, so today we'll start a class on gravity and G-force. Okay, it's an important topic. You're supposed to know this topic with regard to two important things. One is aviation, another is space travel. So we'll be discussing gravity first so that we can understand the concepts which are related to gravity. So as you all know, gravity is basically a force of acceleration. What does it mean? It means that any object on Earth is subject to change in the weight with respect to the velocity. That means if the object is accelerating in an axis, based on the velocity, its weight may vary. So we have a dominant force on Earth, that is the gravitational pull. Okay, it is trying to accelerate our center of gravity towards the center of gravity of the Earth. So this particular rate of acceleration is calculated to be 9.82 meter per second square. So this is also known as small g, or it is the gravitational accelerated force, which you all know. Okay, we all have particular mass, and then we all try to pull each other. This is very subtle fact that we sometimes ignore. Okay, that means every two-person, when they are sitting next to each other, have a gravitational pull. But what happens in reality is that since the pull of the gravity is so high that the individual pull of each other is negated because of that. But if you are in space where there is a zero gravity situation, two persons or two space astronauts will basically try to pull each other. Okay, then the effect of individual gravity will come into play. But here on Earth or any large planet, the gravity is generally so high that it over negates or it overrides the individual gravity. Okay, this is the basic concept. Another concept that you should understand with respect to this one is that human body has learned to survive this particular gravitational pull. That means even though the earth is pulling us towards downwards, we don't usually feel that acceleratory pull on our body because there is a certain kind of adaptation. This is known as gravitational adaptation. We tend to do not consciously think about that the earth is pulling us towards each, but sometimes we can perceive this sensation when we are basically escalating or we're de-escalating in an elevator. You must have feel little bit lightweight or you must have feel little bit underweight when you're traveling in a lift. This is a common subjective feeling that you sometimes get whenever there is a change in the gravity. Okay, if you are there on a stable platform, then the body perceives a gravitational pull of 9.82 meter per second. This is a constant acceleratory pull towards the center of the gravity of the earth exerted on the body, and the body has kind of adjusted over millions of years for this kind of pull. Okay, so whatever the weight we have, that means whatever the weight we register on a weight machine is basically based on this fact that we are being accelerated towards the center of the gravity of the earth with a pull of 9.82 meter per second square. Okay, but such kind of this particular equation changes whenever you are traveling on a flight or you're traveling on a spaceship. This is a difference in this particular gravitational pull whenever you are doing this kind of when you are dealing with this kind of things. So this is the purview of physiology. This is also known as space physiology or aviation physiology, which we are going to discuss today. This is a very important topic, and you might be asked question regarding to this. So sometimes while reading other topics, we tend to forget these special topics. So I'm trying to emphasize on this fact that you should at least read or at least be aware what I am telling today. Okay. So there is two concepts. When the person is standing upright, generally the pull is towards the longitudinal axis of the person. That means from the head to toe there is a pull towards the center of the gravity of the earth. That means we always have a center of gravity. That means our body has a center of gravity. The center of gravity is somewhere near the umbilicus. Okay, for human beings the center of gravity is somewhere near the umbilicus because umbilicus is the one point where the most of the mass is concentrated. That is, it is also known as the center of gravity of the body for human beings. If you have to destabilize a person when the person is standing, what you basically do, if you are aware of the martial arts, few techniques are taught. That means if you have to destabilize a person, you are not supposed to destabilize a person by pushing him towards the head. Okay, this will not destabilize the person. The person will have some kind of corrective responses. Neither you can destabilize the person by pulling the legs. That means the person can stabilize himself by somehow adjustment of the upper body and balance himself or herself. So how can you destabilize a person? You can destabilize a person by pulling in the belt. That means it is very easy to destabilize a person by pulling near or somewhere near the at the center of gravity. This is a common trick that is taught in the martial arts with respect to the gravity. So taking that fact, we know that our body is generally our body is generally perceives this particular acceleratory force in the midpoint, that is in the center of gravity of the body, around near the umbilicus and along the longitudinal axis. The body has three axes: G Z axis, G Y axis, and G X axis. Okay, we'll discuss this axis a little bit later on. So just know that the longitudinal axis is the axis which runs along the spinal cord. This is the axis which is most important with respect to flight or aviation physiology. So whenever we are discussing G, by default we are talking about the GZ axis, that is the axis along the spinal cord. So what do you mean by positive G or the positive GZ? It means that when the gravity is trying to pull you towards the Earth's gravity, that means if you are accelerating towards Earth, it is known as positive G. When you are going in the opposite direction towards the gravity, that is known as negative G. Okay, so these are the two concepts that you are supposed to know. So there are a few other concepts like Gx and Gy, which you can view from the aircraft position. Okay, see, if you're sitting on an aircraft, the diagram is there. If you're sitting on an aircraft, you can see that X, Y, and Z axis in the diagram. So X axis is the longitudinal axis for the body of the airplane. Y axis is the lateral axis going through the airplane, and Z axis is the axis in which position the pilot is sitting or the passengers are sitting. So from the diagram you can see that X, Y, and Z axis. Most important axis that we should deal with is basically the GZ axis, that is the axis through the spinal cord of the human being. Okay, this is a general orientation with which we sit in the airplane. Okay, sometimes you have to consider other axes also, like GX axis. What is GX axis? If you are sitting, I don't know, have you ever seen that spacecraft orientation? They used to sit in a different way in comparison to the aeroplane. That means when in the aeroplane is there, the nose is there, we tend to sit facing the nose of the airplane, that means the front end of the airplane. But in a space flight, when the rocket is lifting up, then people used to sit with respect to the nose of the airplane, but the airplane itself is directed upwards. Okay, have you seen that thing, any such space flight? If you have seen, then you can observe. Okay, you can look for some videos in the internet. You can find that how the space people are, like how the rocket is oriented when the people are sitting, when an air shuttle or a aero shuttle is tethered to an rocket, then the orientation with which the person is sitting or the pilot is sitting is little bit different with compared to the aeroplane. In those scenarios, generally the GX axis will be more dominant or more coming into play. Okay, generally GY axis, that is the axis which is going laterally to the aeroplane. This axis is not very popular because the aeroplane will not twist in this manner. But nowadays, since modern jets are coming, they can go for dogfight. Dogfight means the way the maneuvers are taken in the space or in the air. If you have seen some kind of fighter jets, you'll see that the fighter jets can move in any direction they want. They are not usually flying in the typical fashion in which the normal commercial airplanes are flying. They can twist and turn in any desired way they want. This is known as dogfight. Okay, dogfight means like they can tilt their nose, they can spin within their own axis, then the GY axis will come into play. But most of the time we are concerned with the GZ axis, and Gx axis is with respect to shuttles or the space shuttles, and Gy axis is with respect to the modern aeronautics or the modern planes like Sukhoi 35 and F-22. Okay, so after knowing these facts, we must wonder that why are we even studying all these things. So we are studying these things because we have to understand the effects on the human physiology. We have to understand that how the body is responding with respect to this kind of changes in the gravitational forces or the G forces. Okay, so you can assume that which particular system of the body may be most affected. See, the system of the body which is basically not fixed. We have one system of the body which is not fixed. Okay, almost all the other systems of the body are fixed. That means the respiratory system is fixed and located in one location. The GI system is located and tethered in one position. The neurological system is tethered in one position. But the only migratory system which is mobile in the body is the circulatory system. So the circulatory system follows a particular pattern and it has adapted with respect to the gravity. Okay, so this is the one system which is most crucially affected with respect to the changes in the gravitational forces or the G forces. So we know that under the effect of 1G, when the person is sitting upright, there is still some kind of circulatory discrepancy with respect to the head and the body. When I'm talking in this regard, we are talking specifically about the blood pressure. The blood pressure in a person who is sitting in the upright position, you can assume that the blood pressure is maintained by the pump of the heart and the venous pull, that is from the extremities. Such kind of discrepancies occur in the lower extremities with respect to the cranium. In a person who is not under any compensation, in such kind of persons generally the blood pressure is highest in the lowest extremities. That means since the heart is pumping, it can pull more and more blood in the lower extremities. It can pull more and more blood in the legs. Okay, and since the heart is located, that the head is located above the level of the heart, it has to push extra hard just to push in blood or maintain a particular blood pressure in the cranium. So with respect to heart, the lower extremities and the upper extremities have differential pressure. Okay, but the body knows how to compensate this thing. That means the body knows how to compensate these changes or differences in the blood pressure. It has many compensatory mechanisms which we discussed in the chapter of cardiology. Okay, if you can remember, we have an active muscle pump in the legs. That means the cuff muscle or the leg muscles, they always try to maintain the venous return towards the heart by maintaining an active muscle pump. For those people who are having flaccidity in the lower limbs, in them the blood pressure tends to decrease. Okay, in them the blood pressure has a tendency to decrease. Okay, and the venous pulling is also not so much prominent. If there is a failure in the greater in the deeper in the superficial venous system, then also there is a discrepancy in the blood pressure. There is a fall in the blood pressure. If there is a vasodilatory mechanism because of some kind of toxins, some toxins are there which shows deliberate expansion or deliberate vasodilation throughout the body, most importantly in the lower limbs, then what will happen? There will be pulling of blood towards the lower limb and the venous return will be decreased. If the venous return is decreased, then the BP may fall. Okay, so these are the compensatory mechanisms which the body always tries to play on. All such kind of pressure generally occurs in 1G environment, that is the one positive G pressure environment. So what happens if we change this G force, if we change this physiological phenomena? Such kind of things are basically magnified. All the problems that a body is already facing is magnified, and so large number of discrepancy may occur. That means the brain, which is already getting lower blood pressure with respect to the legs, will be further compromised, will be further getting lesser amount of blood flow, okay, in the intracranial perfusion. So if these G forces are increasing, the body is stressed out and the compensatory mechanism will fail and the person may go in a transient phase of unconsciousness. Okay, how this unconsciousness occur and what are the grades we'll discuss in the next slide. Another effect with respect to the positive G is that sometimes we see that the lungs, which is perfused with blood and air at the same time shows differential perfusion pattern with respect to ventilation. This is known as ventilation to perfusion ratio. So we can see three divisions of these lungs: upper lung, middle lung and the lower lung. Okay, so if you can recall from these chapters of respiratory system, you can just recall that there was a phenomenon that is known as ventilation and perfusion. Okay, that means the most ideal situation in which the lungs can easily oxygenate or deoxygenate is basically when there is a matching in the amount of blood flow and the amount of ventilation that is occurring in a particular segment of the lung. Generally, the upper or the apex of the lung, the upper part of the lung, they have more air and they have less amount of blood, and the base, they have less air and more amount of blood flow. That means it's not that either of the part is getting less amount of ventilation or less amount of perfusion. The only thing is that there is a mismatch. That means sometimes the ventilation is more, sometimes the perfusion is more comparative to each other. But the middle lobe of the lung is generally the part which is generally showing some kind of matching. This particular discrepancy or this particular change in the pattern between the ventilation and the perfusion may be augmented or may be enhanced with respect to changes in the G or the gravitational pull. Okay, so you are supposed to know what is the ventilation perfusion mismatch. We are supposed to know that if there is a changes in the G forces, then smaller air sacs generally tend to collapse. Why? This tends to collapse in the lung basis, which receives accelerated amount of blood flow. Okay, that means there is a very large differences in the ventilation to the perfusion. That means the lower lobes of the lungs or the base of the lungs will have a accelerated or will have an augmented perfusion ratio with respect to the ventilation. So they may leak out fluid, they may leak out extracellular fluid, okay, and pulmonary edema may develop. So this is what you're supposed to know. That means this is also a problem which we should be aware of, besides the unconsciousness which may occur due to poor cerebral perfusion. Okay, and thirdly, because the muscle and the joints and the muscles and the bones are also important for maintaining posture, and they are requiring certain amount of perfusion. If there is a alteration in the blood flow, then the muscles may become flaccid or the muscles may become anoxic. That means they may not get adequate amount of blood flow. There may be pulling of blood towards one part of the body and there is a deprivation of the blood flow pattern towards the other part. So this may cause in turn some kind of pain. Okay, so musculoskeletal pain is also a less encountered, but it is a phenomenon which may be found in case of alteration in the gravitational pull. Okay, so this is something which we should know, a synopsis with regard to the G forces. Now I'll just go to the clinical part. I'll talk about blackouts and grayouts. Okay, I'll just have another slide. So let us categorize different effects of gravity on the body. So this is the topic which will be asked in the examination. The previous topic was an introductory topic. This is a topic which are supposed to know with respect to clinics. Okay, so we already discussed what is rapid acceleration. We have discussed deceleration, and there is another force which is tangential to the body, that is known as centrifugal force. Sometimes when you are tilting in some other axis, then there is a centrifugal force exerted on the body, but we are not supposed to discuss those things today. That is not the purview of the class today. So let us see what amount of gravitational pull or what amount of gravitational force the body can sustain. Okay, so there is a concept of positive G and negative G. Positive G is seen when the body is accelerating, okay, against the gravity, and negative G is when the body is decelerating against the gravity. Okay, so one number you are supposed to remember, that around 5G. And what do you mean by 5G? Means 5G means when the body is basically exerting 5 times the gravity or the 5 times the pull that normally the earth is exerting. That means your weight may increase 5 times when you are exerted a 5G force on the body. Okay, the weight may be incremented 5 times. You may be registering 5 times your weight when you are having a G force of 5G. Okay, these are some facts you are supposed to know. Let us see the changes in the circulatory system properly. So what are the effects of the positive G? Okay, when the gravitational pull is increased 4 to 5 times, the blood is pushed towards the lower parts of the body, including the abdomen. That means the lower parts of the body will be getting congestion of blood. There will be increased flow of blood in the lower parts of the body. So the cardiac output will decrease, and this will result in reduced blood supply to the brain and the eyes. So the blood supply to the brain and the eyes may be compromised, which we discussed earlier. So we have to know few terms. So you can see there are two terms introduced here: gray out and blackout. So you may be asked an individual note, what is gray out? Okay, what gray out means? Graying of vision. When the vision turns gray, or there is a pallor, a pale like pattern in the vision. Okay, the retina is very sensitive to changes in the blood flow pattern. Okay, so even though the entire brain is not getting adequate amount of blood supply, but it is the retina which is basically responding, or it's the retina which is basically showing the most amount of changes, or the early changes. That means it is a prime indicator to define whether the brain is getting adequate amount of perfusion. Okay, so the graying of vision occurs when the blood flow to the eyes starts diminishing. This occurs because retina is more sensitive to hypoxia than the entire brain. Okay, this is a warning signal. That means the body should understand that okay, something wrong is going on. That means graying of the vision is a preemptive decision, or the preemptive warning, which basically tells our body that okay, whatever you are doing, stop, try to go back to the normal position, otherwise you may undergo some other changes which may be irreversible. The next change that occurs is basically known as blackout. Blackout means it is a complete loss of vision when the retina function ceases to function. Okay, there is unconsciousness and the muscular activities are still retained. Even when the eyes are basically blacked out, still you have some kind of functionality left in the muscles, because muscles have not been muscles can undergo hypoxia a little bit more compared to the retina. Okay, but if you continue the blackout for longer duration, then the unconsciousness will follow. Okay, unconsciousness occurs when the G force is more than 5G. That means what we can understand from this point is that up to 5G, generally there will be phenomena of gray out followed by blackout, but up to 5G generally the body can tolerate. Okay, it will not lose its consciousness until 5G limit is exceeded. Okay, it is in this particular limit of 5G when the hypoxia reaches the critical level and causes loss of consciousness. This particular phenomena, or the loss of consciousness because of the change in the gravitational pull, is known as G-lock, G-L-O-C. This is a very important word, or a particular terminology which you may be asked in the examination as a viva question. You may be asked what is G-lock. G-lock means gravitational pull induced loss of consciousness, G-lock. It is usually divided into a relative and an absolute phase. Relative phase means the phase of incapacitation in which the consciousness has been regained, but the person is confused and still remains unable to perform his job. And absolute incapacitation means it is the phase where the person has lost his consciousness, and generally the person is not responsive. That means he or she will not respond during that phase. First the absolute phase will come, then the relative phase will come. Okay, first is you cannot do anything when your consciousness is lost. This usually lasts for around 12 seconds. Okay, for around 12 seconds the person goes completely unconscious. That means for a duration of 12 seconds the person cannot do anything. That is known as the absolute incapacitation stage of G-lock. Relative incapacitation stage of G-lock means when the person has resumed their consciousness but not able to, they can still perform some kind of body maneuvers to adjust themselves. This is known as a relative incapacitation. When you wake up from sleep, sometimes you will see that the brain wakes up but the body is still asleep. Have you ever understood that thing, or have you ever perceived that thing? That has something to do with not something to do with this thing, but it's some kind of same phenomena. Okay, but if you still continue this stage of consciousness for more than 15 seconds in total, then what will happen? Sometimes some areas of the brain will misfire. That means some areas of the brain will start acting automatically and they will cause electrical discharges. These electrical discharges are generally uncoordinated and they may cause some kind of downward motor projections throughout the body, which may be translated or which may be perceived in the fashion of convulsions. That means the person can undergo convulsions if the consciousness is for a longer duration. Okay. Generally, when the military pilots are basically trained, they have to undergo a G-force training or G-force maneuver training. This such kind of training basically is also dedicated or known as AGSM, that is known as anti-gravity straining maneuver. AGSM, anti-gravity straining maneuver. Such kind of maneuvers are basically used or maneuvers are performed using some kind of devices like centrifuges. Centrifuges are the machines which are basically docking a particular military pilot, and then they will be produced or they will be basically exerted on such kind of maneuvers using such certain kind of rotations. Okay, this is known as AGSM. I'll be uploading some kind of videos in the Google Classroom. You can go through those videos and then you can find out what kind of maneuvers are being done. But for the information sake, you are supposed to know that such kind of maneuvers are known as AGSM, anti-gravity straining maneuver. Okay, generally an AGSM is basically targeted to train a pilot to at least sustain around up to 3G of gravitational pull. That means 3 times the gravitational pull they are oriented towards, because up to 3G generally the person will not undergo unconscious. Above 5G the person may go under unconsciousness, so they don't even try to go for 5G. That is the maximum human capacity. That means the human capacity is around 3G. If you are trained properly in a AGSM device, anti-gravity straining maneuver device, you can train your body to sustain or basically burden yourself with around 3G of pull. Okay, sometimes nowadays the requirement is so high because some of the jet planes are so fast that they can accelerate and deaccelerate in very certain very fast maneuver. Sometimes we require some kind of assistance. That means without assistance the person cannot survive more than 3G, but with some kind of assistance, that means some kind of specially designed suits are there. These suits will basically try to compress the blood from the lower extremities towards the heart. That means these suits are basically, whenever you are flying, the suit has a computer inbuilt in them. The suit will understand that what kind of gravitational pull is exerted on the body. Based on this thing, this suit will try to compress the legs or the lower extremities. This will assist in pulling or basically pushing the blood towards the heart. Okay, which is the primary problem here. So if we apply some kind of pressure in the legs, the blood will be pulled towards the, or blood will be basically pushed towards the heart. Such kind of specially tactically devised suits are known as G suits or ATGAGS. Okay, anti-traction anti-gravity suit. Okay, these suits are special suits which aid in the special tactical maneuvers when the jet fighter pilots are flying, so that they can sustain more than a little bit more than 3G, maybe up to 5G. Okay, sometimes these suits can assist the pilot to bear a force up to 9 positive G, but this is the absolute upper limit for human endurance. That means with the assistance of the suit stretching the maximum human capacity, a particular trained pilot may bear a force up to positive 9G. Okay, so this is what you're supposed to know: 3G, 5G and 9G. 3G is the tactical under with assistance, that is the AGSM training, and ATAGS suit enables you to go up to 9G. But if you still keep on increasing the pressure more and more, and the bones will be crushed towards your own weight. That means you will become so heavyweight that your bones will not be able to sustain your own body weight. So this occurs in the 20G realm. That means even if by some miraculous measure your circulatory system is still functioning, still your bones will be crushed when you are under the influence of 20G. Okay. What are the effects of negative G? Till now we have discussed positive G. Negative G means going against the gravity, when you are feeling inverted flying. Okay. Under such conditions there is hyperemia. That means initially there was less blood in the brain for positive G. In hyperemic stage there is more blood in the brain. This is known as hyperemic stage. This occurs into -4 to -6G. Okay. This increases the blood flow in the brain or the head, and more blood accumulates in the head and cause brain edema. The capillaries of the brain are usually acquainted for 1G. Okay. That means they can maintain the exchange of the blood with respect to the brain tissue when the person is exerted on a G force of 1. But if it is around -6 to -4, then there will be more amount of blood than the brain can handle. That means capillaries can handle. In those kind of situations, the blood will accumulate in the brain and the capillaries will burst and there will be edema in the brain. Okay. This congestion may cause flushing of face and this will cause headache. Sometimes you have heard the phenomena known as migraine. Migraine means where there is a small localized increase in a cerebral blood flow. Okay, because of some phenomena, there is an increase in the pressure in the brain. Such kind of pressure in the brain causes leakage of the capillaries and sometimes some kind of minor edema may occur in the brain. This is generally perceived as a phenomena of migraine. Mostly occurs in the females around 30 age or around near their periods when they are having more amount of estrogen. Estrogen generally has a vasodilatory effect. When the estrogen goes in the cerebral perfusion, then they vasodilate or they will cause the arterial dilatation. There will be more blood going to the brain, particularly in one side or the side in which the female is dominant. Then they may have a transient attack of migraine or a debilitating headache which may reduce their function. Okay, something similar to this thing. Okay, the next phenomenon that you should know is known as red out. In that phenomena we understood blackout and gray out. Now here negative G causes red out. Red out means there will be blurring of vision and there will be sudden reddening of vision. That means the vision will appear to be red because there is so much of congestion in the retinal arteries, near the retinal arteries. So the eyes will basically feel as if it is filled with blood. The vision will turn red. This is known as red out. This occurs in the realm of -15 to -20 G. In this range, the retina perceives the blood vessels in the retina pops out and then generally they start discharging more and more blood in the system. So basically you may have the phenomena of red out. Okay. And the CSF circulation, which is a basically negatively driven circulation, is generally compromised. So there is a pooling of CSF in the cranium because of this red out. Okay. And the final stage in the negative G pattern is again a loss of consciousness. This is because high negative G increases the pressure in the blood vessels, the chest and the neck. It causes bradycardia and irregular heartbeats. That means if all the bloods are pulled towards the head, then the heart will not get adequate amount of blood to pump. So they will not be able to maintain the blood flow or the exchange of blood flow with respect to the brain. So this is known as loss of consciousness due to the stagnation of the blood in the head. So these are the few topics you are supposed to know today regarding the G force. I will upload these 2 slides. With this I would like to conclude the class. Hope you have understood something. Okay, thank you.